What new details do you know?
Yeah, it's interesting. We're sort of getting a shape of what some of these deals could look like, lending itself really to a number of bilateral deals. We are getting some new information into the newsroom here, Angie, talking specifically about the deal for Ontario. And it sounds like it'll be worth $73 billion over 10 years for the province of Ontario. Of that, new money is $30 billion. So $3 billion per year that is being added to any type of deal with Ontario. And this is sort of lending itself more again to the likelihood that we are going to see a number of these sort of bilateral deals. We're expecting the Prime Minister to start the meeting tomorrow with basically a presentation in the offer. And then from there, it's likely that a number of these provinces will take away some of that information, or others may be coming essentially ready to sign. We're hearing from sources in Ontario that essentially they are ready to go because of what they'd seen with the healthcare deal, or I should say with the childcare deal, where they were the last holdout and they believe that they did not get more out of it by holding out. So they really don't want that to happen again. They know how important this healthcare deal is, and they're looking to go forward with it as soon as possible. There are other premiers that are coming to the table ready for a fight, if one could say that. It sounds from what we are getting from sources around the table is that essentially that Quebec may be looking to sort of take this away and sort of mull it over and then see what other negotiation they can get. And then other provinces may be doing similar. So it's interesting, Angie, to really sort of paint a picture of what is happening behind the scenes already. That it sounds like you have a number of provinces that could be coming to the table ready to go, and some of these side deals, I should say, or bilateral deals are already taking shape in a form or another.
And this is a very important narrative that the Prime Minister wants to maintain, saying that he is listening to each and every premier for the needs of those provinces, wanting to, of course, the House is going to be sitting today, and there'll be a lot of questions around health care. Perhaps we might get a little bit here and there. We might see, the health minister, he may give us an indication. He's been pretty tight-lipped about everything, not wanting to sort of show all his cards.
And Angie, the customization of each one of these is really key when you consider the fact that each province has different wants, has different needs within their healthcare networks and within delivering their healthcare and what they need to do. So I think the fact that the Prime Minister is looking to try and do this with each and every one of them, and Ontario is a big one, right? The fact that they were the holdout in childcare, the fact that they don't believe that they got a lot more than any other province, so they are keen to sort of sign on the dotted line and move on from this and make sure that they're delivering healthcare for Ontarians.
All right, Mike, great update there, and we'll continue to follow it. Our senior political correspondent for CTV News Channel, Michael Couteur, for us in Ottawa. Thank you again for this, Mike.